Daniel, tell me about Johns Hopkins University and the study that came out that they published. COVID-19 has, and I'm quoting it, relatively no effect on deaths in the U.S. Then it was retracted. Tell me about this.
Sure. It's funny that it seems like the retraction is always in one direction. It's always when there's any good news, so to speak, to sort of say, hey, maybe the virus is not quite as deadly, as bad as we thought. That always gets dinged, but it's never the other way around when, demonstratively they overstate the number of deaths. We've already seen that with the Imperial College. It's been overstated. Somehow that never gets retracted. So that in itself is very interesting. Basically, there's nothing really new here other than it originally came from someone associated with the economics department at Johns Hopkins. But basically, even the New York Times, many publications have been pointing out that heart attacks and other common causes of death seem to be down. And that's very puzzling, and it's something that needs to be studied. And what this economics professor did, it was an hour-long video presentation, and then it looks like a student in one of their newsletters wrote up kind of an interview and an article on it, which is not necessarily synonymous with everything she said, as any article is, that if you take everything in totality, what it seems to be is that the virus is mainly killing those who are slated to die within the year, which is why she noted from her data, it doesn't appear that there are excess deaths this year, in the year 2020, that are over and beyond the baseline that we traditionally have. So in other words, if you would have the same amount of, let's say, 5-year average of heart attacks, strokes, pneumonia deaths, you would have 260,000 COVID excess deaths on top of that. What you're seeing is almost a displacement that almost commensurately with the drop in deaths from those other common causes is the official number of 260,000 or so COVID deaths, which would suggest, at least according to her research, that it's primarily people not just that were maybe unhealthy or had underlying conditions. Some of them certainly get sick and maybe are hospitalized, but the ones who ultimately die, for the most part, with some exceptions, seem to be those who are slated to die anyway. And
statistically,
this is sort of, and one of two things are happening. And I think it's a mixture of both. To a certain extent, there's misclassification.
Yes.
So this is your case of someone testing positive, but they didn't really have such a symptomatic case, but they died of other things. That's automatically a COVID death. That we already know from CDC guidance. Or others that legitimately were gotten by it, but they were in hospice. For example, just on Sunday, a bunch of Rutgers University immunologists came out with a study of 2 hospitals in New Jersey from May where they looked at 650 people who died there, and they found 90% of them had DNR orders on them. Now, if you're the typical 65, 68-year-old guy, maybe you have some diabetes and heart condition, and you get sick with COVID, you're in the hospital, you're not going to have a pre-existing DNR order on you.
No. You don't, because if you're 65 years old, most likely you haven't been in and had those giant conversations yet with your family on just, I don't want to be on a machine for a long time. It's a great piece also on Blaze TV or theblaze.com. You can hear Daniel's podcast also on The Blaze, the Conservative Review podcast. Daniel Horowitz, thank you so much for being on the program with us.
Really enjoyed it. Take care.
You bet. Thank you. So, Stu, I want to switch to you on the news that you were talking about yesterday. We only have a minute. That we're going to see numbers go up on COVID cases, and they're going to be blamed on Thanksgiving.
Yeah, it's just a quirk in the data that basically a lot of places, I mean, like Texas didn't report for several days any numbers because of the Thanksgiving break. So what we're seeing, if you look at the charts the last few days, you might be encouraged by them because you're seeing a downturn in almost every measure. Mm-hmm. And what is likely going to happen, and today's the day it's going to start, is we're going to see all these deaths and cases piled up from last week that were not reported all get reported in the next couple of days.
And they're going to say, look at what happened.
Thanksgiving. Everyone went and they didn't listen. They didn't listen to us on Thanksgiving. We need to have more restrictive measures, more lockdowns. You're going to see that call because these numbers are going to go through the roof and maybe hit all-time highs over the next few days into the coming weeks. So it's something to look forward to. as we get these numbers today. And I don't mean forward as you're excited, but like looking into the future, because if we don't know the facts on that, they're going to use it against us.
And now that you know the facts, you can look forward to straightening out the narrative.